Okay. There's actually, this study has been divided into two parts because there were numerous results. So the first part was about the exercise groups, and this presentation that should be presented by my colleague Eleni Tzekaki is centered on the VRADA training system that Dr. Adrian has talked to you in the previous presentation. As already been said, VRADA training system is a virtual reality system that is person-centered technology, provides many benefits. It is very cozy for the patient to be employed in that. And the aim of this study was to determine the effect of VRADA training system on the inflammatory markers, amyloid beta and tau, in order to see if this intervention could also help on the process. The demographics of the patients, again, okay, there are no significant differences as should be in order for the study to be successful. So we have a cycle ergometer. You have seen that in the previous presentation. Mount head that is performed with a cycle ergometer equipped with a VR headed mounted display and the controllers. Patients are in a VR environment resembling a forest, a pathway through the forest. And during this pathway, there are some animals appearing in order to stimulate the vision. And also they have to perform some simple mathematical equations. The patients follow this schedule 2 to 3 sessions per week for 12 weeks. And this was a mild exercise again, but also the patients soon they'll be able to increase the speed of the cycling as it progressed. Okay, and these are the results from interleukin-1 beta tumor necrosis factor A. There is some non-significant differences regarding interleukin-1 beta and tumor necrosis A. However, the beneficial effect in the matter is that patients that did not follow any interventions has presented increased levels of interleukin-1 beta. So this could be promising in order to stall the progression of inflammation. Regarding amyloid clearance, there were some non-significant differences again between the baseline group and the 3-month follow-up group. On the other hand, groups that did not follow any intervention presenting decreased levels of amyloid 42, increased levels of amyloid 40, and of course, a very decreased level of the ratio 42 to 40, meaning that the amyloid clearance from the brain is not performed well. This is the effect of VRADA on tau protein. Patients following VRADA did not present increased titers of total tau protein and phosphorylated tau protein. And also, the correlation analysis proved that, again, the decrease at the ratio phospho-tau to beta 42 is linked with neuroinflammation amelioration. So, for a discussion, VRADA intervention ameliorates inflammatory cytokines and increases amyloid clearance of patients with MCI. The subject in the VR intervention group strongly adhered to the training and dropout number was very low. And correlation of future of VR with more engaged and safer artificial interactive environments should be performed. This study had some limitations. I've already stated those to the previous questions. This was a very small pilot study. More studies should be performed with a larger number of patients, with longer follow-ups, in order to have some more clear and sturdy results. Also, the monitoring of the physical activity and the experimental sessions should be engaged more regarding regarding the monitoring from the scientific personnel, and also A backbone study with a long-term follow-up is especially to evaluate the rehabilitation efficacy in details. Thanks again to all our collaborators that were very important in the performance of the study. Thank you all for hearing me again.